This is made by Chetty Endoscopy. This is made in India stent. This assembly is more or less the same as any other self-expanding stent. The good thing I have here is that there is a marker there outside. We have the markings here. Can you see show this? So that we can position it from outside. So remember that earlier we used to use the external markers, whether the metallic or the injectable. But since these external markers are available, most of the time we don't require those markers. If we need to be more sure, we can always put the scope parallel to the stent and make sure of the position of it.
How much does it cost?
How much is the cost of this stent? This is 12,000 rupees. It's made of it's a nitinol stent. I mentioned earlier that a firm guide wire, stiff guide wire. Stiff guide wires are usually not available nowadays, but it's important to have a stiff guide wire. Otherwise, the stent can curl in the neck or throat of the patient and sometimes can be difficult to negotiate. And make sure that you are sliding over the stent. Leave it. You need to keep an eye on the floor that the upper marker of the stent doesn't move. Upper marker of the stent is at around 27 centimeters from the and we have to keep a check on it.
Ajay, Dr.
Yes,
sir. It is a regular stent because now the growth extends up to almost close to lower stages.
Yes.
Are you supposed to leave the stent in the stomach?
Yes.
Is it anti-depressant?
The good question for me that yes, it's obvious that you're going to compromise the G junction and the incidence of the reflux will increase. But if you look at the state of our anti-reflux stents, we have a problem with them. You know that dual stent, we don't use that. And the availability to me, I mean, if I have a good anti-reflux stent, I'll prefer that. But then in a situation like that, the best thing will be to have the anti-reflux layers after the stent. But then yes, that is a problem and one can face it later on. Just can you focus it here? Please see here, this is the most important thing. I needed to keep a check of this, that is 30 centimeter mark. It remains as it is here outside. And on the floor you see that it doesn't move. You can see the lower part is already deployed and it's being opened. Can you show me the upper part of the stent now? Can you show the upper mark of the stent? Yes. Now we need to keep a check both simultaneously at the endoscopic at the mouth end at the 27 centimeter remains like that. And the upper part, it remains where it is on the fluoroscopy. With this, I don't find the need of putting extra markers not anymore.
Very good.
And these stents are deployed at the same place. Can you show the fluoro? You should notice that the stent is opening, but we haven't missed our position. We are right there. You need a stability in your hand. And we are just about to finish the whole deployment of the stent. And it remains a marker here at 27 centimeters to see that. And I see some fluid coming, the stent opening tells me that the whole stent is deployed. And now we remove that. Can you show the fluoro?
Can you see the door?
Make sure that there is no resistance because sometimes this assembly can get entangled and then you can pull the scope, pull the stent out. That shouldn't happen. We have taken out this. I always feel comfortable if I recheck the position of the stent by putting the scope in.
Well done. Give a big hand.
Thank you, sir. You have given a big hand, sir.
Why endoscopy again?
So I like to make sure that the position of the stent is okay. But I would not like to go through and through. Sir, are you happy with that?
Very happy.
This is exactly a 27 centimeter if you look at the scope. So you must be proud of yourself as you taught me then. Proud of your students?
Thank you. Well, very good. Excellent.
The precaution patients has to go with the advice to follow anti-reflux measures. And we can start actually feeding the patient right in the evening today.
Thank you, Ajay.
Thank you for that, sir.
Everybody happy with you, including myself.
Thank you, sir. Thank you, sir. Thank you, Dr. Ajay. We are going over back to the double fellow room.